This bill is a monumental disaster, and I have not talked about it at all. So let me just go through it. Let me just go through why Karoline Leavitt is wrong when she says that this is all waste, fraud, and abuse. I'll start there, and then I'll go to parts of the bill that I actually agree with, parts that are egregious, parts that are just wasteful, parts that I don't care about. Let's start with waste, fraud, and abuse. So there's two claims here. 1.5 million illegal immigrants are on Medicaid. Second claim is that there's so much recipient fraud on Medicaid that we can cut $1 trillion from the program over the next 10 years and everything's going to be fine. All right, let's go over the first one. So, no, you cannot go on Medicaid if you're an illegal immigrant. Simply not possible. Now, some states have their own programs out of their own money where they give health insurance to illegal immigrants. And earlier provisions of this bill, I believe this was struck down by the parliamentarian, said that we're cutting funding to those states who use their own money to fund health insurance for illegal immigrants. Even though that's a great program if for states that do that, because guess what? If those illegal immigrants are uninsured, they're still going to be showing up to hospitals, right? And now you're paying for it with your insurance premiums, because those hospitals have to claw back the money somehow, or else they go out of business. They already operate in negative margins so often. Let's go to recipient fraud. All right, so 5% of Medicaid payments are improper. The improper payments, 80% of them are administrative and essentially documentational. So too much money going to the wrong place, and a lot of that's clawed back eventually because we know that they're improper after the fact. Now, the other 20% of that 5%, so 1%, is due to fraud. And the vast majority of this fraud is provider fraud, billing Medicaid when they should not have billed Medicaid, billing Medicaid too much, whatever. The amount of recipient fraud in that 1% is so low that no one's even tried to measure it. There's not even a good estimate I could find. Recipient fraud is absurdly low. So that when you have people like Karoline Leavitt who say, or someone I saw on Fox News recently, say 8 million people in New York are on Medicaid, and only 5 million are actually eligible. It's like, what? And so 3 million people are committing fraud, and you know that, and they're still on Medicaid? Like, why cut Medicaid then? Why institute the work requirements? If you know that you can get all this from fraud, just beat the fraud if it's so easy. But obviously, these cuts to Medicaid, SNAP, the ACA expansion, the ACA premiums, the Medicaid expansion, ACA subsidies, it's a disaster. It's going to, as the CBO estimates, 8 to 12 million people are going to be cut off their Medicaid. I'll explain why here, because we've tried work programs in the past, and they do not increase employment at all. They just kick people off their health insurance one way or another. And these work requirements extend all the way up to age 64. So these are pretty old people. These are like grandparents having to prove through intense documentation every 6 months or a month to the government that they're not able-bodied, or they're essentially disqualified in some other way, right? Every single month, or they're working, right? That's what happened in Arkansas. People were actually working, and through documentation errors, it's like, and bureaucracy, a lot of 95% of the people who were kicked off their health insurance didn't deserve to be kicked off their health insurance. So this work requirement is meant to kick off people who shouldn't be on the program, as they say. That's not, all right, so if we're kicking out people who aren't working, so now they're sitting at home, not working, uninsured. What if they get sick? All right, so they go to a hospital cares for them. They have to charge, as the same with the illegal immigrants, they have to charge other people who pay their premiums through private insurance more money to cover that loss, or else they go out of business. So as a society, we've decided that we're going to give healthcare to people no matter what. So we should at least, we should insure them, right? The worst way to incentivize employment is health insurance. It's pretty much the worst way to do it, because even if the people still get sick and they still have to go to the hospital, and the hospital still has to care for them. So let's go to this part. All right. deportation, border wall, and Golden Dome. I'm in favor of one of those, and I think they don't list the additional CPB funding. They also don't list in this the Pentagon funding. So I'm completely against the Pentagon funding, completely against the Golden Dome, completely against the detention beds, but I am for the border wall and a bigger border patrol. Because I don't like when people evade border patrol. I think it's a big issue. And although they did it at a relatively low rate under Biden, right? He had the lowest evasion rate of any president ever recorded. I believe at one time it was 8%. It was extremely low. When in Bill Clinton and Bush, it was up to 50% because our border patrol was not big enough. I believe that we should have that smaller, as close to 0% as we can. And this is a good way to do that. Golden Dome is stupid. Like, don't we already have missile interception systems? Deportations, detention beds. I obviously disagree with them because I don't think we should be deporting dramatically more people, because if we are, then they're not criminals. They're people here who were here with breaking the civil immigration violation of unlawful presence, and we raided their workplace, and now we stuck them in detention beds and we're deporting them. Doesn't matter. They've been here for 6 years and have a family. We're going to deport them anyways. Clearly immoral. Stick with the 100,000 detention beds that we had before for actual criminals, right? And that's more than enough. Border wall, obviously great. Nothing bad there. It's pretty cheap too. But that basically covers it. Child tax credit, great. SALT, I'm not the biggest fan. That's obviously not too progressive. But you know, you won't find me complaining about tax cuts to the rich too often, because I just don't care about tax cuts that much. In my ideal world, we would have a higher tax bracket, higher taxes on the rich, sure, up to like 60% maybe, but definitely no wealth tax, right? Because getting money from rich people does not enable you to do any government function that you couldn't prior to doing that. It's just like a fetish, right? Tax the rich. You can do the same programs you could before. Like I would much rather have a luxury tax or regulations on what apartments we're building, or on what products we're building, right, in our economy, and what industry we're prioritizing, such that it doesn't benefit rich people. But I have no problem with rich people accumulating money. I don't. But obviously, so this bill, everything else is inconsequential besides really the border wall and CPB funding, which is good. Besides the Medicaid and SNAP cuts, like all the other tax cuts are immaterial. No one's going to feel the impact of them, but people will feel the impact of this. And it's just not, there's no reality in which people don't get kicked off their health insurance, in which people, sometimes with children, as long as the children are over 14, are going to get kicked off their SNAP benefits. So, disaster of a bill, not going to accomplish much. It could have been, for a good bill, it could have just been a border bill, like Biden's border bill, right? Reduce border patrol evasions, all that's good stuff. But this is not that bill. We're cutting the most important programs that we have in our society for no reason. Not to pay for tax. I mean, that's because that's not how government finance works. We're just doing it for no reason. Literally for no reason. And there's also that $35 copayment levied on literally the poorest Americans. Like literally the bottom quintile have to pay this copayment to see their doctor. It's like, what is that going to do? I'm surprised the parliamentarian hasn't struck that down, because is that really budgetary? That seems more like ideological. But, you know, it's not a good situation.